Hey everybody, this is Alec with Home and Rehab, and what I wanted to talk to you today was something a little bit interesting. I've actually had multiple cases in the past week of patients who were referred over who actually had random swelling in both legs and weren't entirely sure why. Now, normally we associate swelling with something like an injury. I sprain my ankle and all of a sudden it becomes a balloon. Or I have a broken bone and the local area becomes very swollen and inflamed. Sometimes even cuts and sometimes minor strains can actually get a little bit swollen. But sometimes some of these idiopathic or these seemingly random swelling issues that occur in our lower extremities can have a very normal explanation that goes beyond just normal injury. That actually can do with our heart and cardiovascular health. So, the way our body works when it comes to circulation in the lower extremities is actually a little bit different than how it circulates to the rest of our body. One of the things that becomes very interesting is that the distance from the heart actually affects the ability of that pump to get things back. So one of the things you'll notice is that when you look at the lower extremities in particular, something called the muscular pump becomes a little bit more important, which is the relationship between your muscles, skin, and the veins and circulation around there. So in order to get blood out of my leg, it actually becomes very important that I have a strong contraction in my calf. What that does is it actually compresses all the local venous structures to allow a little bit of a push up. That brings some of the blood away from my leg, and then it is stopped on the way down by some valves that close back through. However, sometimes because of aging, other times because of other cardiovascular issues, these valves can become a little bit looser, or our veins themselves can spread, allowing more of the blood to backflow. Then it becomes more important to have both a strong heart and strong muscles to encourage this pump to work a little bit harder. So one of the things that we tend to find in a lot of patients who have some of this onset of swelling is something we call just generalized deconditioning. That means that the muscles of their body are not producing quite as much force as we'd like to see. Now, of course, exercise is an obvious solution to this. We can, as we talked in the past, make our heart stronger by encouraging more cardiovascular exercise. By doing more resistance training throughout our legs, both our thighs and into our lower legs like the calves, we can actually see an increase in both muscle strength, force production, and of course girth. That means the larger space that's taken up by the muscle structures can give us a little bit better pump. Throughout all of that, what we should begin to see then is that we have better circulation in those lower extremities, which can decrease some of this swelling. And that becomes one of our main treatments for things like this. Obviously, there are some medications we can take that decrease some of the blood content in our body. Taking some of the water, like diuretics, some of these pills can actually make it so we have less blood volume, which means we're going to have less general swelling as well. But it doesn't treat the root cause of our problem, which is that laxity. So if we can address that by trying to encourage improved muscular pumping both from our heart and from our lower limbs, we can actually sometimes decrease some of that idiopathic swelling. But one of the most important things to do is not just assume this is automatically the cause. So what we did when we saw patients with this was we started doing some cardiovascular conditioning testing, but we also suggested that they go see a cardiovascular specialist and make sure that this is indeed what's going on. Some of them had actually already been, and that made my decision-making process a little bit easier. But if we're not entirely sure what's going on, we should always make sure that that is indeed the case, and make sure that when we start going in this certain direction, we can push as we're moving correctly. Because there are other types of lower extremity edema. For example, lymphedema can be another issue within the lower legs. Sometimes this can be caused by blockages within our lymph nodes, and other things can affect this, including infection, history of cancer, and various surgeries. So we always want to make sure that all avenues have been addressed before we just go one direction. But if you have something that seems a little bit random and you're not entirely sure where it's coming from, we may have an explanation for you. And by using correct diagnostic procedures, sometimes we can take what seems like a very complicated issue and give it a relatively simple solution through the correct types of exercise. If you guys have more questions about anything like this, please let us know, either in the comments on this post or through direct message to our Facebook page, so we can get an idea of what else you would like to know about in the new year. We'll talk to you all soon.